All right, chapter 13, the central nervous system, part 2. So continuing with the cerebrum. We talked about its structural arrangement. Now we'll talk more about its functional organization. So there are many sensory areas within the cerebrum where the sensation arrives. The sensory information arrives for different sensations. They are primarily in the posterior or back portion of the cerebrum. So they include the primary visual area found in the occipital lobe. We have the primary gustatory area found in the insula, which we can't see on the surface. We've got the primary auditory area found in the temporal lobe, the primary olfactory area also found in the temporal lobe, and finally the primary somatosensory area in that post-central gyrus of the parietal lobe. Again, primary somatosensory area, that's the sensations of the skin, touch, tickle, itch, pain, temperature, and so on. All right, this primary somatosensory area of the parietal lobe, turns out it is arranged with a map of the human body on it. So different portions of that gyrus is associated with different portions of the body. And so sensory information from those different regions go to that part of the parietal lobe. And as you can see, the body is mapped out in kind of a weird way. Basically, areas with more sensory receptors that are more receptive, more sensitive, have larger portions of this gyrus than other areas. So the face, very big, lots of sensory receptors in the face. The elbow, not so much. All right, then we have secondary sensory areas. They are nearby the primary sensory areas, and their job is to start integrating that sensory information to make it useful. So for instance, the visual associated area near the primary visual area, it helps let you recognize the objects. You are now aware of what it is you're looking at. The associated auditory area, it lets you help to distinguish between sounds. So it's not just one big bah, but an actual different sound. The somatosensory associated area helps to distinguish things by touch. So if you close your eyes and touch something, you can start to figure out what it is because of that area. And it also is involved in sensory memory formation. The primary motor area is in the frontal lobe. It is in the pre-central gyrus. And the primary motor area is where all commands for the skeletal muscles originate. So every command for moving a skeletal muscle starts in that gyrus, in the primary motor area. And again, we have the body mapped out on this gyrus. This time the body is mapped out based on the number of skeletal muscles. So we have lots of muscles, little bitty muscles in the hand, in the face, in the tongue, so they get a large portion of this gyrus. Elbow, not so much. We do have muscles in the arms and legs, but they're big, so there's not as many of them as in the face and hands. There's also primary premotor area. The premotor area is near the primary motor area. This is where our learned sequential complicated actions occur. So this is where we get that muscle memory. So if someone's a basketball player and they've been doing the layups since they were 6 years old, the ability to go through those complex motions to do a layup, that is learned here in this part of the brain. It could also be for playing the piano or driving the car. There are special areas for speech. So the Broca's speech area, it allows you to control the muscles for speech. So that is in the frontal lobe to actually control the muscles of speech. There's the Wernicke's area, which is in the back part of the brain, sort of the border between temporal and parietal. That lets you interpret the meaning of speech. So one, Broca lets you control the muscles so you can talk. Wernicke's area lets you understand the words of speech. There's the common integrative area, also in the parietal lobe, that integrates the sensory information to help you start to decide on a response to say something that's touching you or tickling you or a loud noise or whatever. And then probably what you might think of as the most important area is the prefrontal cortex, the very anterior portion of the frontal lobe. This is where our memory and reasoning and intellect and judgment personality, all those things that you think of as you, housed here in the prefrontal cortex of the frontal lobe. All right, there are some additional gray matter within the cerebrum. These are deeper in the whiter tissue. These are referred to collectively as the basal nuclei. Basal nuclei are important for movement and controlling movement, so they help the frontal lobe in controlling movement. They're especially important in the starts and stops of movement and the intensity, how powerful the voluntary movement is. So the basal nuclei, very important. Parkinson's disease is a disease where the basal nuclei have begun to degenerate. People who have this, they start to shake uncontrollably. They have muscles being contracted when they shouldn't be, so they get muscle rigidity. They have trouble controlling starts and stops of movement. Huntington's disease is another disease where the degeneration of the basal nuclei is occurring. So they have very rapid movements, very jerky, involuntary movements. And also for Huntington's disease, they have a lot of mental deterioration. So there's obviously other functions associated with the basal nuclei. Both of these disorders, Parkinson's and Huntington's, are degenerative. They get worse over time. There are only treatments to try to slow down the breakdown of the basal nuclei. Limbic system. Limbic system is a series of structures in the diencephalon and the cerebrum that are involved in emotions. So the limbic system is often called the emotional brain. It generates emotional responses, stores memories for emotions, decides how you should respond to a circumstance emotionally, and also has a connection to the sense of smell. So smell is thought to be connected to both emotions and memories. All right, we have the ventricles. So here are a view, a transverse section of the cerebrum. These spaces here are the right and left lateral ventricles. They have these structures called the choroid plexus. Choroid plexus is blood capillaries covered by the epidermal cells, cells that produce the cerebral spinal fluid. So the cerebrospinal fluid fills the lateral ventricles and then moves on to other ventricles in the brain. There are 4 total ventricles in the brain. You have the right and left lateral ventricles, one in each hemisphere. You have the third ventricle. The third ventricle is in the space between the 2 halves of the diencephalon. And then the fourth ventricle. The fourth ventricle is in that space between the brainstem and the cerebellum. All 4 ventricles are connected to each other. So cerebrospinal fluid flows from the lateral ventricles into the third ventricle, into the fourth ventricle. And from there, it goes out to the space around the brain and also down the central canal of the spinal cord and the space around the spinal cord. So the 4 ventricles are connected to each other and then also connect to the subarachnoid space around the brain and spinal cord and the central canal within the spinal cord. And the cerebrospinal fluid outside of the brain and spinal cord help to buoy it, to hold it in space, so that it's floating and not lying on our very hard bones. Meninges. Meninges are 3 layers of connective tissue that protect and surround and protect the brain and spinal cord. They are continuous structures around the brain and spinal cord. The most superficial layer of the meninges is the dura mater. Dura mater is very dense, very strong. So it is directly below the bone of the skull. Deep to the dura mater is the arachnoid mater. The arachnoid mater is thinner, middle layer. Below or deep from the arachnoid mater is a space called the subarachnoid space. This space is where the cerebrospinal fluid is, where it's helping to buoy the brain and spinal cord so they do not have to touch the hard bones. And then deep to the subarachnoid space is the pia mater, the thinnest layer of the meninges that lies directly on the surface of the brain and spinal cord. So here you can see pia mater in place, pia mater removed. Spinal cord. Spinal cord starts at the foramen magnum. So that is the beginning of the spinal cord. Any tissue above it is medulla oblongata, below it is spinal cord. And it carries signals to and from the body, from the neck, the arms, the legs, and the trunk. Spinal cord has a cervical enlargement, a widened area in the neck area that's sending out nerves to and from the arms. And then toward its inferior end, it has a lumbar enlargement that's sending out nerves to and from the legs. The spinal cord goes all the way down to about L2, or between the lumbar 1 and lumbar 2 vertebra. So it does not go all the way through the vertebral canal. Its very end is called the conus medullaris. There are still structures traveling through the vertebral cavity. These are spinal nerves, and collectively they're known as cauda equina because people thought it looked kind of like a horse's tail. There are 31 segments to the spinal cord. Each segment has its own pair of spinal nerves. If you look at a transverse section of the spinal cord, you see that there's white matter on the outside, gray matter on the inside. There's a space or fissure in the front called the ventral median fissure, a space or fissure in the back called the dorsal median sulcus. The spinal cord looks kind of like it has a right and left side. The gray matter gets broken into three regions: the dorsal horn in the back, lateral horn in the side, and ventral horn to the front. In the center of the gray matter is a space called the central canal. Cerebrospinal fluid travels the length of the spinal cord through the central canal. It's also worth noting that the dorsal horn has where sensory information arrives. The lateral horn sends out motor commands for the autonomic nervous system, and the ventral horn sends out motor commands for the somatic motor nervous system. Coming off of the spinal cord, you will find our roots. So you have dorsal roots coming off the back, leading to a dorsal root ganglion where the sensory neurons' cell bodies are, leading to the spinal nerve. So this is carrying sensory information to the spinal cord. And then in the front, the ventral root is the part coming off the spinal cord carrying motor commands from the spinal cord. The dorsal root and ventral root fuse to form the spinal nerves that then go out to the body. So the spinal nerves carry both sensory information and motor information. Sensory information traveling through the dorsal root to the spinal cord, motor commands going through the ventral root out to the body. So here again, sensory information traveling through the dorsal root, arriving at the dorsal horn to connect interneurons and the information wherever it needs to go, and then motor commands coming to the lateral and ventral horns, carrying those motor commands out the ventral root to the body. So that is, again, sending information going up from the dorsal horn, descending information arriving at the lateral and ventral horns. Cerebral spinal accident is a stroke. That is when blood flow is blocked by a blocked artery, or blood flow doesn't arrive because an artery has burst. A stroke always leads to damage to the brain tissue, although there can be some amount of recovery. It'll never be 100%. So again, cerebral vascular accident, the official word for stroke. Cerebral vascular accident, official word for stroke. And that is it for this part of the lecture.